What are you doing for neuropathy?
Oh, that's a huge question.
Is it diabetic neuropathy of what we're talking about?
In some cases, I mean, and then we have the catch-all of idiopathic, meaning we don't know what caused it. And I think that
So what defines neuropathy? Give us a basic understanding.
Basic understanding is it's damage to the nerves, usually in your feet, sometimes in the lower extremities. That's where you commonly see it, less commonly in the hands. Typically when I see a patient with neuropathy in the upper extremities, it's from chemotherapy or 40 years of type 1 diabetes. So the vast majority of patients, the neuropathy involves the distal lower extremities, meaning usually below the knees.
Like tingling, burning,
all those
the
symptoms,
above?
And loss of what we call proprioception. And this is
what does that mean? What do you mean?
Well, proprioception is your ability for your mind, your brain to know where your feet are, which is, as you can imagine, extremely important in balance, walking upstairs, daily activities. And it can lead to falls and inability to walk eventually.
Okay, so what do you do for it?
Well, so that's a tough one. We've talked about spinal cord stimulation. That can ameliorate the symptoms in a lot of patients, but it doesn't treat the underlying cause.
So it gets rid of the pain, but doesn't take care of the actual problem.
It doesn't take care of the actual problem. And so I think we're doing a really poor job of actually identifying what the problem is. So the problem is damage to nerves, and we've got biopsies, and I can show you pictures. It's great, where you see the nerves in the skin, and the terminal nerves are dying. They're gone. And yet, if you restore the blood flow, so in a diabetic patient, a lot of times it's not just the diabetes, but it's the vascular disease that's occurring down there.
Okay.
And so nobody's really looking at that, unfortunately, a lot of times. So they've got compromised blood flow, which is causing a loss of these nerves. So you restore the blood flow, in some cases you can restore or prevent further loss of those nerves. And then we have the experimental treatments that we're doing, regenerative treatments with growth factors. And
injecting their feet,
yes,
their extremities with,
yes.
Interesting.
And we're seeing regrowth of these nerves, and we're reversing the neuropathy.